Good morning. I'm Susan Kosman. I'm the Chief Nursing Officer at Aetna, and I have a few minutes to try to tackle healthcare delivery in the United States and how this applies to it. So I hope you can stick with me for a few minutes. The group really had a wonderful discussion. I appreciate the opportunity, Patricia and Marla and the IOM, to be part of that. And we actually had an interesting discussion about, well, can we do this here? Do we need to do it here? And the answer is absolutely yes. There are a lot of opportunities here. So I'm going to talk about three main areas: aligning the care and payment delivery system, expanding technology and consumer engagement, and then wrap that around education and some examples that already exist. There really is an opportunity, a huge opportunity, to transform the way we deliver healthcare in the United States, and some things are already on the path to that. Obviously, the Affordable Care Act has taken a lot of steps to get the dialogue much more intensified, much more broad-based, but there's a lot of work to continue to do. There's an opportunity to create a simpler, integrated system that really centers on the individual consumer, and we heard that from a couple of panelists. Our system today is heavily focused on acute care, heavily focused on the provider and certainly important aspects of the delivery system, but at the heart of it is the person who receives that care and the system in which they receive it. Krishna talked about the, you called it the iron triangle, or the triple aim is the other nice word for it. But clearly the opportunities for us are around access, quality, and affordability, and nursing is integral to all of those aims and achieving them. Aligning the care delivery and payment models has at its fundamental core the opportunity to drastically increase access to care, access to quality care that has been proven out in many studies. But we need to align incent and reward value and outcomes, not just the provision of care, but really what happens to individuals that partake of that. Is their quality of life improved? Are their outcomes actually better? We talked a bit about measurement before. A key piece of that from a nursing perspective is really thinking about scope of practice and having individuals be able to work at the top of their license. We have a lot of work in the United States to remove barriers to that and make it really accessible in all 50 states. Those of you that are intimate with those details, we have a lot of regulations, requirements, and it's difficult to scale things across multiple locations because of some of that. Work is underway and it's really positive, but we have a lot of work to do. Doing that, though, will increase efficiency, it'll increase the providers, and again, ultimately leading to increasing access across the board. Technology is available. I was having a conversation this morning where there's about now 100,000 applications, health applications, that we can download on those ubiquitous cell phones that we all have. Most folks go back to those applications that they've downloaded between 1 and 2 times. So there's no want of technology, but it's how do we make it meaningful? How do we get it in the hands of the individuals who can use it? How do we help our providers understand the value of it and actually bring it forward to the consumers that they're working with? It will really be able to provide a level of convenience to providers and consumers that we haven't really seen, but I think there's still a lot of opportunity in that space. We also talk, and I think it's an important opportunity, about enhancing patient and caregiver engagement in care. We've talked a lot about some of the drivers of cost and need for care around chronic conditions and an aging population in the United States, and really having consumers begin to engage along the continuum of their care, understand a little bit better about what they need, what their families need, but there's a lot more opportunity there to truly have them be partners in that care. And I see nursing and midwifery at a key intersection of being part of helping individuals understand their options and opportunities. That requires, though, a pillar of support around education, and we have been a little bit of a drive to have enhanced or a degree focus on education, and that is important, but there's also a skill expansion that's critical to this in terms of not only clinical skills, but also skills in working with populations, helping individuals understand and advance them along their continuum of engagement, and as panelists talked about before, understanding how to run businesses and the financial aspects of what we're doing. It also takes really thinking about cross professional collaboration. There's a lot of innovative groups in education that are looking to bring, really start this early on in the career education, but there's a lot more opportunity for that as well in terms of bringing professionals together as they're learning their craft to really think about how do we deliver care, not as individual silos as we discussed at the beginning, but really as part of a whole, and thinking about how we take those tasks and spread them across the group that's caring for a community. And I just want to close by saying that there are examples of innovative nurse-led models in the United States. Some of the reasons why they're in individual places I've talked about already in terms of just some of the regulatory and legal requirements around that. But the American Academy of Nursing has put out information on edge runners, nurse-led models that are really innovative and do wonderful things across the continuum of care, everything from chronic illness to geriatrics, maternal child health, transition of cares, really across sites of services as well. So there are models that are out there in the United States to expand. There are models that we've learned of to import. And the question that I would like to leave the group with is, as we talked about it as a group, can we do this? I think the question I'd like to leave for the discussion is, can we afford not to think about this at this point? Is it really an option, or do we really have to get engaged at how we expand this into the United States as well?